Hey there, it's Lynn, and it is day 13 of my 22 Push-Up Challenge 2.0. Tonight I wanted to talk a little bit more about chronic pain, and I think what I'd like to talk about are starting points to dealing with chronic pain that are steps you may take before if you're able, before resorting to, as needed, narcotic medications. In my research that I was doing, I found that there is a risk with chronic or prolonged use of opioid medications for pain management. There's an increased risk for a number of things, including something called opioid-induced hyperalgesia, which is an increased response to painful stimulus, or a pain response to previously non-painful stimulus upon cessation of the morphine-based medication or the opioid medication, which, to say the very least, is an extremely painful, uncomfortable, and awful body response for someone to have to go to, especially someone already dealing with the presence of chronic pain that they are having a hard time managing. So, in thinking about pain, pain does a few things. What does pain do? It increases anger. Sometimes it increases our emotional lability. It will decrease our energy and also decrease our impulse control. So just in terms of some very basic steps, in terms of beginning to deal with our chronic pain when the pain is really starting to get to us. If we are able, stop for a moment, examine your environment, and rate your pain on a 0 to 10 scale. After you've done that, if you are able to reduce your stress or remove yourself from your environment for a period of cool down time, at least 15 minutes, maybe more if you require that, do so. Don't force yourself to think about anything but how you are feeling, and start to formulate a plan in terms of what you need to do to deal with the pain that is beginning to come on or starting to be unmanageable. Try, if you are able, the non-medicinal treatments, some of which we've already talked about, that you may find work for you or have worked for you in the past. That may include, but is not limited to, things like exercise. Some people find yoga or meditation helpful. Some people find other things, such as massage, a helpful thing. The point with that is, in terms of pain, the types of exercise that bring our anxiety down and increase our blood flow, particularly to the area that is causing us pain, can help to do things like offload fluid that is causing greater inflammation and therefore decrease pain, and bring much needed nutrients to the area that needs to be, at the very least, soothed or perhaps healed. So think about that when you begin to deal with pain, if it is becoming difficult to manage. Try things that work for you that are non-medicinal if you feel you are able to do so. Use your pain medications as they are directed, and if you need them, certainly take them. And I can't stress as much, take them as directed. If you're finding your pain is unmanageable without more medication than is directed, that is something you need to discuss with your prescribing health professional, because there may be other medications you need to try. There may be other combinations of therapies. Your physician or nurse practitioner or your chosen medical professional who knows you may be able to suggest and start the ball rolling on to help you effectively deal with your chronic pain, not just in the present but in the long term. Try to get rest if you are able to do so. Try to give yourself a little time out for 15 to 30 minutes, particularly if you've taken some medication for pain. And before you resume your activities, assess how you are feeling. Re-rate your pain on a 0 to 10 scale. You need to know where you're at and how your body's responding. And decide how much you are able to do, what you can then re-engage in. And think realistically and honestly about that. After you organize your activities in small blocks and start to re-engage, after about 30 to 60 minutes, reassess your pain yet again. You want to know if your pain medication is working. If it's working great, I would still take note of how you're feeling, beginning, middle, and kind of end of the episode of unmanageable pain that you're trying to deal with, and discuss with your prescribing physician if you take medication, or your other health professional such as physiotherapists, just for example, that you may see for pain management. Discuss how you're faring with that and whether or not there are better ways to deal, or ways you can kind of tweak in a good way your pain management strategies. So hopefully that little 8-point list is helpful in terms of looking at pain management, and when the pain begins to become unmanageable, what do I do in the immediate moments, and how do I proceed and make my decisions. I'm going to do a little bit more research on chronic pain, talk a little bit more tomorrow about this topic, and yeah, I think that's what I've got to say for this evening. I'm going to do my best to do my push-ups all in a row, as always, and here we go. Okay. Okay, I think that was 22. We'll double check them. Thanks so much for watching. Thanks for the support, being part of this great conversation. Let's keep the ball rolling, keep the conversation going, and do what we can to support our combat veterans when they return home from deployment, and provide support and understanding to their families as well. Okay, thanks everybody. See you tomorrow. Have a great Saturday. Again, happy Thanksgiving. Ciao for now.